Well, good morning, Miss Krissa, and I just want to ask you a couple of things about your experience. How has your experience been with us since you first came with your veins?
Well, to be honest with you, Dr. Vermata, I was on antidepressants because I had a problem with my physique, mainly because I developed varicosities at the age of 25, and I pretty much wore pants ever since first noticing the varicose veins. And I felt bad because 25 years old, you're supposed to literally show off your legs and your body and everything, and I just shut myself away. And I sought help from you, and you were able to restore my self-confidence, and I thank you for that.
Well, thank you very much for your kind words. So how do your legs feel? Because I know you told me at the beginning, the feeling was bad in your legs themselves, where there was pain and discomfort and all that stuff.
Yes, whenever I would walk previously, I would drag one of my legs, particularly my left leg, which was the worst one. I would have shooting pains go down on I would have problems with my blood pressure fluctuating. And since after several procedures, I'm able to run, play with my kids, and I feel like I've regained my vitality thanks to you.
Well, thank you very much, Ms. Krissa. We really appreciate that. Thank you.
You're welcome.
That's good.